presenting a case of revision phase in female 50-year of old. Known case of diabetic mellitus presented with bilateral nasal obstruction, headache, and nasal discharge for since last 6 months. Symptoms were progressive, more pronounced on the left side, and associated with sense of facial heaviness. There was no history of epistaxis or visual disturbances. CT scan of paranasal sinuses showed left sphenoethmoidal recess obstruction, post-surgical changes from previous phase, and no obvious bone erosion or feature suggest of recurrent invasive fungal disease. Based on this clinical and radiological finding, a diagnosis of post-phase sequelae with Synechiae formation and sphenoethmoidal recess obstruction with terminate hypertrophy was made. She had a significant past history of functional endoscopic sinus surgery performed 4 years back for rhino-orbital mucormycosis, following which she remained asymptomatic for a period of 4 years. On diagnostic nasal endoscopy, there was evidence of left-sided synechiae between the lateral nasal wall and septum, with inferior turbinate hypertrophy bilaterally, contributing to airway compromise. Patient was planned for revision endoscopic sinus surgery. Bilateral revision phase was performed and left-sided synechiae were released. Bilateral inferior turbinate reduction was done and sphenoid sinus were widely opened bilaterally, ensuring adequate drainage and ventilation. No intraoperative evidence of recurrent mucormycosis was noted. Post-operatively, patient is stable and improved nasal airway. She has been advised strict glycemic control, nasal saline irrigation, and regular endoscopic follow-up to prevent recurrence of the adhesions. Post-phase synechia is common cause of persistent obstruction. Sphenoethmosis patency is crucial in patients with headache. In post-mucormycosis cases, vigilance for recurrence and metabolic control are essential. So this case required bilateral sphenoethmoid recess opening, synechiae release, and terminate hypertrophy reduction. So in this case, you can see this left-sided sphenoethmoid recess is completely blocked, even though sphenoid sinus is normal. Now I am doing the terminate hypertrophy reduction. After that, I will proceed for sphenoethmoid recess opening bilaterally. On the left side, in CT scan, there was completely obstructs and no opening of sphenoid sinus is seen in this case. So both side bad sphenoethmoid recess was open after bilateral terminate reduction. You can see in this case, this is the right side sphenoethmoid recess was completely open. That was completely obstructing the right sphenoethmoid recess. Now, same on left side, this sphenoid recess is also completely blocked. Now, this left side, you can see this sphenoethmoid sinus or recess was blocked and now completely open up.